Go ahead, Jean.
Good evening, everybody. Thank you guys so much for joining us tonight. And I'm so excited that I'm able to come to you live through this technology service that we have. I'm excited to have you all join us. I know it's been a very chaotic few weeks. I thank you all for having patience with us, particularly about the national conference, but it has been postponed and hopefully you've all received notification about that. But for matters tonight, we have the privilege of having Dr. Senna join us tonight live to talk to us all and answer some of your questions about scarring alopecia and COVID-19, otherwise known as the coronavirus. Dr. Senna is the Assistant Professor of Dermatology at Harvard Medical School, and she's also the co-director at the Mass General Hospital Hair Loss Clinic. She's also a member of our board of directors as well. So, Dr. Senna, thank you so much for joining us tonight and taking time out to talk with our members.
Jean, I'm thrilled to be able to connect this way after spending way too much time with my children, attempting to homeschool them. I've worked really hard to try to create a comprehensive number of things that I think will be informative for everyone, and I'm excited to answer your questions. So thank you for joining us, and don't forget that all of this will be recorded so that if there's something you feel like you missed or something you want to go back to, that's something you're going to be able to do. I'm really excited to be here. Thanks for having me.
Sure. Well, you've got the floor now, so we're going to go right into your presentation, and then at the end we have questions that have been given to us earlier today, and we can also take some questions live. So I'll let you get started.
Sounds good. So tonight, of course, we're talking about coronavirus and scarring alopecia. And what I've tried to do is put myself in your shoes and sort of anticipate the types of questions that I would have if I had a scarring alopecia and was dealing with this pandemic. A couple of caveats. Number one, I have two small daughters, ages 5 and 8. My husband is under strict instruction to keep them in the basement and away from here. But I'm very concerned that I might have one of those moments where like a child runs in, like was made popular on whatever news show it was. Hopefully that won't happen, but I just wanted to give that caveat. The other thing was we did get some questions about closed captioning for tonight. Unfortunately, we weren't able to set that up, but hopefully my voice is loud enough, and certainly if there's anything that anyone missed, I'm happy to try to go back over it for anyone who's hearing impaired. So moving along to our presentation. So first, I want to start from the top by just saying thank you. Jean Pickford, our CARF Executive Director, has worked tirelessly for this group and for all of our patients. I asked her when we were prepping for this show, you know, how many unpaid hours have you worked, Jean? And she was like, don't even ask that question. You know, she, like all of us on the CARF Board of Directors, are very committed to all of you. And it just feels so great to be a part of an organization who does these types of things for patients. Colleen Leader is our new CARF Administrative Director. She's awesome. She's like a total dynamo. And so for any of you who have the opportunity to interact with her, please welcome her. She's been fantastic so far. Hacho Samersian, I'm sorry if I butchered your name, Hacho. But as you all know, he's our fearless leader on the LPP Let's Put Out the Fire Facebook page. And as a patient himself, he brings a really cool perspective to all of this. And for all that he does, thank you. Michael Graham, who is doing the production of this webinar, who has been the most patient, kind, wonderful person. We're grateful to you too, Mike. To the CARF Board of Directors, like I said before, my colleagues, patients affected by this who sit on the board with us. We couldn't do anything that we do without you. And to all of you patients, some of the smartest, most savvy people I know, great questions, always so smart. Always willing to sort of, you know, put yourselves out there and ask the important questions that you need to advocate for yourselves, and we're grateful for you. So don't forget, if you're not yet part of the CARF group, please go on to www.carfinternational.org and please register, because they're a great group and we're really trying to bring good information to you guys. So conflicts of interest is important. I have no conflicts of interest that are financial that are related to this talk. So let's talk about our outline. So the first thing is, what the heck is coronavirus? We've all read and we know stuff about it, but let's kind of delve into it briefly so we can orient ourselves. The second thing is, scarring alopecia is an autoimmune disease. So does this put me at higher risk of COVID-19? A very reasonable, important question. How does my cicatricial alopecia treatment affect my risk of getting COVID-19? And we'll go through all of that. And then lastly, will the stress from COVID-19 make my hair loss worse? So we'll address all of those things tonight. And I love The Cure. For those of you like me who grew up in the 80s and 90s, you might know that The Cure is famous for songs like Friday, I'm in Love. Well, I'm no expert on COVID-19. I am not an infectious disease doctor. I am not an immunologist, but I know as a physician enough about COVID-19 as it relates to you. And I just thought that this was a funny meme. And I will just also say as a caveat, there are a few jokey things that I put in through this webinar. They are not meant to lessen the gravity of the situation that we're in right now. They're just to provide a little humor, a little relief to all of us who are feeling so much stress around all of this uncertainty. So what the heck is coronavirus? I love this. Ever wonder what the extra stands for? So it always comes back to the Greek. So those of you who don't know, I am Greek, and so we always have to bring it back to the Greeks. So if you've seen the movie My Big Fat Greek Wedding, you have to know it always comes back to the Greeks. He even made, the dad in the movie even made toga be a Greek word. Anyway, the name is actually derived from the Latin corona, which means crown, itself borrowing from the Greek koroni, meaning garland or wreath. And the name refers to the characteristic appearance of these virion projections that emerge from the outside of the virus, because in the cross-section it looks reminiscent of a crown or wreath. And this picture here is from one of my favorite shows, The Crown, which is a great show on Netflix for binge watching since we all have so much time on our hands. Here, actress Claire Foy, who plays Queen Elizabeth, is being coronated, or it's a scene during her coronation from the show. So if you're looking for a good show, it's a good one to watch. So what is coronavirus? So coronaviruses are a huge family of viruses that typically lead to respiratory illnesses. They're transmitted from animals, typically to people. So because of that, they're called zoonotic viruses. If you've had the common cold in the past, the chances are that you've had a type of coronavirus. However, there are some coronaviruses that can be more severe. For example, you may have heard of the Middle East Respiratory Syndrome, or MERS. There's severe acute respiratory syndrome, or SARS. And yes, most recently, COVID-19, or coronavirus 19, which is a brand new virus not previously identified in humans. And why are these cute little animals up here? Well, it's because the civet cat, which is at the top of the screen, was thought to be the first reason for the SARS, or severe acute respiratory syndrome, outbreak that occurred. And the dromedary camel down at the bottom was thought to be one of the main carriers for the Middle East respiratory syndrome. And it is thought that perhaps bats have been involved in both of these syndromes, and that bats are probably one of the vectors that have brought the virus to humans for the COVID-19 outbreak as well. So the problem is that although some coronaviruses will just cause minor colds, in more severe cases, like MERS, SARS, and now COVID-19, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. That's really what's driving all of the anxiety and uncertainty that we feel now. So what are the COVID-19 symptoms? Well, this is taken directly from an email that was received by me from Mass General. Now, I should make clear that none of the things that I'm saying are directly, attributed to my employer. These are my opinions as a doctor there. But what they said is that at least if one of the following is present, a fever, sore throat, cough, shortness of breath, muscle aches, or persistent chest pain or tightness, those are potentially symptoms that should suggest, particularly if they're persistent and new, that you should receive testing. So who is considered high risk? So we know that people over the age of 70 are considered high risk. We also know that because this disease can affect the lungs, if you already have a severe or even moderate chronic lung disease like asthma, bronchiectasis, cystic fibrosis, COPD, you are at higher risk for this condition. If you have severe chronic medical problems, particularly if these chronic medical problems are not under good control, severe heart disease, poorly controlled diabetes, these are all things that could put you at higher risk. For those who are severely immunocompromised, like those who could be going through bone marrow transplants or have leukemia or lymphoma or have advanced AIDS, for example, with a CD4 count, which is a type of immune cell count that we will sometimes monitor in these patients below 200, also at high risk. And then lastly, those who are on immunocompromising medications, and we're going to get to a lot of detail about this in a bit. So why is the coronavirus not like the flu? Please, dear God, if there's one thing you take away from this, please know the coronavirus is not like the flu. So the European Centers for Disease Control estimated that 1 in every 1,000 people who are infected with the flu die each year in the European Union, United Kingdom, Norway, and Iceland. By comparison, the estimated mortality for COVID-19 was 20 to 30 per 1,000 people. However, today, the information coming out of NPR and Italy shows that the mortality rate is actually even higher than that. So I wrote it down here someplace, but basically it runs about 3 times that estimation. So this is not the flu because people are dying at much higher rates of it. Unlike influenza, there is no vaccine and there is no specific treatment for this disease. That's also very problematic. And then it's very transmissible, at least as much as the flu, if not more so. And people, like with the flu, you can transmit the virus before you even know you have it, making it incredibly dangerous for people. So further, because it's a new virus, none of us have prior immunity, which in theory means that if the entire human population is potentially susceptible to getting this condition. And so again, for a little humor, Vegas in 3 months be like trying to, instead of chips, we're going to be using toilet paper to, wage our bets on things. Right now, Vegas, I believe, is closed. But again, just a little humor to kind of make our shoulders go down a little bit and let us take a deep breath. So scarring alopecia is an autoimmune disease. So does that put me at high risk of COVID-19? Great question. Additionally, in the past, I've been told that one reason I have LPP is because my immune system is too strong in attacking my hair follicles. Is that a correct statement? And if it is, will this protect me or others from COVID-19? So let's dig into these things. So the first thing to understand is that autoimmune diseases absolutely are conditions where the body's immune cells erroneously attack normal tissues in the body. What's important to understand is that some autoimmune diseases are systemic, meaning that they cause inflammation or damage to multiple tissues throughout the body, our entire system. Examples of this include systemic lupus, which can affect the skin, kidneys, joints, blood cells, etc. Rheumatoid arthritis, where multiple joints throughout the body are affected, and there's an increased risk of other comorbidities like heart disease and other things. Uncontrolled diabetes, where the pancreas is the main organ affected, but it can lead to severe complications in other areas like the kidneys, eyes, etc. In contrast, there are other autoimmune diseases that are localized, meaning that they only affect one part of the body. Examples here include autoimmune thyroid disease, autoimmune diseases of the eye, and yes, scarring alopecia. And people will often ask me, patients, understandably, they'll say, but so little is known about scarring alopecia. How do we know that it isn't systemic? And it's a great question, and it's one that I had 3-4 years ago when we started this study, where we literally looked at over 2,000 patient charts and thumbed through them, and we literally put everything on there: autoimmune disease, thyroid disease, cardiac disease, diabetes, you name it. We put it on there to try and whittle this out. And what we found is, and this is an article in Press in the Journal of the American Academy of Dermatology, is that scarring alopecia patients have the same risk as the general public of having all conditions, including other autoimmune conditions. And this held true for thyroid disease. Now, I know there have been other studies done by other groups who have suggested that maybe patients with LPP, FFA, and scarring alopecias might have higher risk of thyroid disease. We did not find that in our group, so that's sort of like a question mark. But when we looked at everything else, that did not pan out. In fact, what we found, surprisingly, was that our scarring alopecia patients had lower odds of congestive heart failure, stroke, and glaucoma. More to come on that. We're continuing to work on it. But this says to me, you know, if there was really something going on here more systemically, that doesn't mean that as individuals, we might not have our own issues. But as a whole, as a group, when we look at scarring alopecia patients, this does not appear to be a systemic condition. So then what factors do matter when we think about scarring alopecia and COVID-19? Okay, it's not a systemic autoimmune disease, so that doesn't make me at risk. But what other things might? Well, if the same things that put people in the general public at high risk apply to you, then that's a check on that side. And those include age greater than or equal to 70, severe chronic lung disease, severe chronic medical problems, and severely immunocompromised, like we talked about. In addition, because a lot of patients who have scarring alopecias are on systemic, meaning oral or injectable medications, things that work systemically throughout the whole body to reduce the immune response, that is your extra consideration. Okay, so things like methotrexate, cyclosporin, Celsect, which is mycophenolate mofetil, JAK inhibitors like Xeljanz, Jakafi, tofacitinib, ruxolitinib, oral prednisone, intramuscular steroids, not scalp steroids, intramuscular steroids, which can have a longer effect, or any biologic medication like Humira, infliximab, also known as Remicade, etc. And so, understandably, patients will say, okay, so how much do these risk factors? I'm on this medication, I'm 73, and I have asthma. Unfortunately, no one really knows because this virus is so new. However, the way I would look at it from a common sense approach, if it were me, is that the more risk factors you have, the more careful, like crazy careful, you need to be until this all pans out. You're watching this webinar because you care about yourself and your condition. You deserve the best and you need to be smart. This is another thing. So one bright side from coronavirus is that where's Wally? Games have become much easier. You can just spot Wally at the beach or in the park or anywhere else because there's no one else around. Again, trying to invoke a little bit of humor here to calm us all down. So what can you do? Oh boy, this is Lizzo saying, is she going to tell me to wash my hands again? I know you all know to wash your hands. So let's get to the important stuff. So yeah, you have to wash your hands. But yes, also practice social distance like it's your job. So again, the more check marks you have on that slide I showed of, do you have the general public high risk factors, and are you on any of those medications? The more check marks you have, the more you got to follow these rules. So practice social distancing like it's your job. Cook your own food. Go food shopping at off hours, or better yet, get groceries delivered to you. Amazon Fresh, Stop and Shop Peapod, your local grocery store, if it's a chain, might offer this. Cancel all non-urgent and other appointments. And a lot of doctors now are moving to e-medicine. So it's possible that if you're having an issue or you're having a flare, you're having a problem or a big question, either via your patient portal or email or e-visits, you can work that out. If you have any symptoms of COVID-19, you have to call your primary care doctor right away and tell the triage person that you're on a systemic immunosuppressive medication if you are. Again, that's that list I showed earlier. And we're getting to the other medications, so stick with me a minute. If you have symptoms or are diagnosed with COVID-19, you need to stop that list of immunosuppressive medications right away. And you only restart them if recommended by your prescribing doctor after your symptoms have subsided. Now, the American Academy of Dermatology, and this is really important, got together a bunch of experts in infectious disease within dermatology, those who prescribe a lot of biologics and immunosuppressive medications, and came up just yesterday with a list of guidelines for us, for patients who, just like you, who may be on immunosuppressive medications for their derm conditions. And basically they said, if you are on an immunosuppressive medication, you don't have symptoms, you're being extremely careful the way I talked about, and you are feeling fine, there is absolutely no reason for you to discontinue your immunosuppressive medication. So that's important. You know, some of this becomes a personal decision about how comfortable you feel one way or the other, but that is what all these experts in dermatology are advising right now. So the question is, okay, in all seriousness, how do we stop meds if we want to or need to? Cold turkey? So yeah, I mean, ideally cyclosporin should be tapered because cyclosporin can affect like blood pressure, which is the main reason why. But other medications, and I polled all of my female derm brilliant colleagues on this before putting together this talk too. But other medications like methotrexate, JAK inhibitors, Cellcept, biologics can be stopped cold turkey if you need to. So whether you choose to do that because you just feel like you want to, you don't have to, or you develop symptoms or you actually get diagnosed with coronavirus and you have to stop, you don't have to worry about your general health about that at all. Will you flare? It's very likely that unless you're doing something else to treat your hair loss condition, yes, you will notice a flare in your hair loss condition. However, these things can be safely restarted after coronavirus, if you were to get it, God forbid, were to play out its course. These are things that can be safely restarted if needed. In addition, you should talk to your own prescribing doctors about what else you can do in the meantime, because there are other things that you can do that can help treat your scarring alopecia. So a lot of patients will understandably ask, what about topical treatments? Did they impact my risk of COVID-19? So topical steroids, topical tacrolimus, or other calcineurin inhibitors like pimecrolimus or Elidel, Protopic is the other trade name. Topical JAK inhibitors, no. Assuming you are applying these medications to your scalp or head and neck, the penetration through the skin into the bloodstream is negligible. Topical treatments reduce inflammation only where they're applied, not systemically or throughout the body. So you are not at increased risk of COVID-19 because of topical treatments. And the same is true, by the way, of steroid scalp injections, because those act locally as well. What about other medications? So other oral medications or treatments do not increase your risk of COVID-19. And these include low-dose naltrexone, antihistamines like Zyrtec or Allegra, retinoids like isotretinoin, anti-androgens like finasteride, Propecia, or dutasteride, gabapentin, antibiotics like doxycycline, light devices like Excimer or Levia, or any of you who might be using low-level laser light devices, hydroxychloroquine or Plaquenil, and certainly PRP and things like that would not increase your risk. So let's talk more. There's an asterisk there by Plaquenil because really intelligently, a lot of you have had a lot of questions about that, so we're going to get to that as well. So what is the deal with hydroxychloroquine or Plaquenil anyway? So chloroquine was first made in 1934, and it's a form of quinine or quinine, depending on how you want to pronounce it, tomato. Quinine or quinine is a compound found in the back bark of the cinchona tree native to Peru. Initially, both medications were used to treat and prevent malaria. Molecularly, the two medications, hydroxychloroquine and chloroquine, are nearly identical. But hydroxychloroquine was reported to be as active as chloroquine against malaria and much less toxic. And so that sort of fell into more favor as time went on. Hydroxychloroquine was approved for medical use in the United States in 1955. And it's on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in the health system. Hydroxychloroquine has been shown to be effective against numerous viruses, including coronaviruses. Recently, Chinese teams showed that chloroquine and hydroxychloroquine could reduce the length of hospital stay and decrease the severity of COVID-19 pneumonia. But the optimal dosage for COVID-19 still needs to be determined. Chinese authorities preliminarily reported that 100 infected patients with COVID-19 who were treated with chloroquine or hydroxychloroquine experienced a more rapid decline in fever, improvement of lung CT or CAT scan images, and required a shorter time to recover compared with control groups who did not receive those medications. There were no obvious serious adverse effects from treatment, and the Chinese Medical Advisory Board has suggested that chloroquine and hydroxychloroquine inclusion in the SARS-CoV-2 or COVID-19 treatment guidelines. As a result, these medications are probably the first drugs to be used in China and abroad on the front line for the treatment of severe COVID-19 infections. So how does hydroxychloroquine do this? So the first thing to understand is how coronavirus actually affects our body to begin with. So if you see this little spidery looking thing, that's the coronavirus in the schematic, and the purple cells are our body cells. So what you see first is that there's a attachment of the coronavirus to our body cells. And then the coronavirus gains entry to our body cells. And then once it's in the body cells, it starts replicating itself, making many copies of itself. And then it assembles and matures, and then boom, comes out of the cell and is released to then go on and infect numerous other cells in the body, which of course then our body's immune system says, hey, there's something bad going on here, let's go in. And in its attempt to sort of get rid of the virus, it can also cause a lot of inflammation that can cause damage to tissues like our lungs and other organs. So how does hydroxychloroquine fix this? So basically, number one, it prevents the virus from binding to the surface on our body cells, thereby preventing entry of the virus into our body cells. Secondly, it inhibits the replication of the virus in our body cells. And thirdly, it helps reduce that inflammation so we don't have as robust a crazy inflammatory response. So will your hydroxychloroquine, if you're on it, protect you against COVID-19? It's likely. Again, the optimal dosing is still being determined, but for sure, it's not going to hurt. And some people have asked, you know, is there going to be a shortage of hydroxychloroquine and things like that? And I did my due diligence, and I went to FDA.gov and looked up drug shortages, and hydroxychloroquine is not on there. I mean, I think things that we have going for us are the fact that it's generic and it's been around forever. I also looked up to see if there were shortages of hydroxychloroquine in Italy and in China. At least for my Google search and trying to like go through different documents, there did not appear to be any shortages there. But you know, if you're worried about that, then perhaps this is a time that you should talk to your insurance company and your doctor about them prescribing an additional 90-day or 30-day supply to carry you over if there's a problem. So understandably, people will ask, will the stress from this make my hair loss worse? And let me tell you, if any of you are home with children, or any of you who might have children can imagine yourselves in this situation where you're not only working from home, but you have small children who you have to homeschool, this is basically live footage of me, day 1 to day 3 of homeschooling. So I feel you. We're all feeling the stress in different ways, whether it's parents we're worried about, or family members, or friends, or we have, you know, someone who's important to us who's sick, or whatever. You know, we're all in this together, and I totally hear you, and we're all feeling it for sure. So regarding stress and scarring alopecia, though, you know, I give a whole talk on mindfulness and how it affects scarring alopecia at the CAR Patient Physician Conference, but I thought it would be important to review some pertinent things that apply to COVID-19 here. So to understand how stress might affect scarring alopecia, we first need to discuss something important, which is called immune privilege. So what's immune privilege? Well, immune privilege is this natural protective mechanism of the body that's thought to exist only in certain body sites. The purpose of this mechanism is to prevent immune attack and damage to vulnerable body sites. So what are the body sites that have immune privilege in humans? Those include the eye, the brain, parts of the ovaries and testes, the maternal fetal unit when a woman is pregnant, and you guessed it, folks, the hair follicle. So the loss of this immune privilege or protection, this shield around these areas of the body, are thought to contribute to a number of conditions, including multiple sclerosis, autoimmune eye disease or uveitis, fetal rejection during pregnancy loss, and inflammatory hair loss disorders. So what does immune privilege actually do for the hair follicle normally? Well, the hair follicle immune privilege basically sends out different signals to the body or creates barriers. So for example, it'll send out signals to the immune system saying, hey guys, I'm safe, I'm not dangerous, please don't attack me. So the immune cells know to stay away. There's also no lymph nodes directly there in the area to be able to mount an immune response super easily. And lastly, the collagen and elastin fibers that are around in the intervening skin between the hair follicles create a physical barrier to immune cells to make it a little bit harder for them to sort of penetrate and cause autoimmune conditions. Now, what happens when we add stress? When stress is brought on, and that can be severe emotional stress. Right now, like I'm a stressed out person, I'm type A. No, not that day to day, but the crazy stress, right? Or like an illness or something like that, right? Increased signaling can occur from the nervous system. And when that happens, there's increased neurogenic inflammation, which means that there's inflammation that actually comes up from the nerves to stimulate or drive inflammation to occur. And what does that all do? That causes all these natural barriers of immune privilege to collapse and allows these inflammatory cells to come and hover around the bulge or that middle part of the hair follicle and create worsening scarring alopecia potentially. Now, if we're able to mitigate our stress, reduce our stress, ameliorate it, prevent it from happening at all, then when that goes away, so do the immune cells, and we're able to bring back our immune privilege to protect our hair follicles. So like I always say to my patients, stress reduction has to be a part of your treatment regimen. And that's particularly true now in these uncertain times. So how do we reduce stress? I mean, it's easier said than done, right? I mean, I should take my own advice. But social engagement is so important to reducing stress, and doing that in creative ways like Zoom parties or chats with your friends, either on the phone or via a web interface like this where you can actually see people. And so many of us are so fortunate now to be able to do FaceTime and things like that on our mobile devices. We should take advantage of these things. I love adult coloring books. You can buy these on Amazon. Sometimes they have them in like major stores and stuff, but basically these are like mandalas and other like cool drawing things that you can get, coloring pencils, and fill them in. And it's just amazing. Like, I am not an artist by any means. I can't even draw a stick figure well. My 5-year-old does way better drawings than I do, but just the process of like filling in these drawings and coloring them in, the focus on that kind of takes you away from the stress that you're dealing with. And for those of you who might like something like that, it can be really cool. The other thing that's really important is to exercise your body and or mind. There are some of us who might be physically disabled or otherwise have challenges to exercising our bodies, but you can still exercise your mind. And so one thing to know about is that Peloton is an awesome company. They are giving a 90-day free trial for their Peloton app. And at first when my friend told me about this, I was like, well, I don't have a Peloton bike. Like, what use is this going to be to me? But it's amazing, guys. They have yoga, meditation, other exercises. If you have a treadmill or you can be creative with running, they have those. They have like arm exercises. It's just fantastic. You don't need a Peloton bike. It's a 90-day free trial. And since we're all locked up at home anyway, it's worth trying. And then, of course, there are these various apps that you can access that have a lot of free material on them for mindfulness and meditation. And it's amazing. Only 10 or 20 minutes of mindfulness daily can really help to reduce stress. That's been shown in multiple clinical studies that have been done in various diseases and autoimmune conditions. So I really urge you to access these things if you can. One thing that I love to follow on Instagram, for those of you who might, is this group called Power of Positivity. And when I saw this, I thought so much about all of you and those people who are dealing with really hard times, particularly now. And I love this. It says, ships don't sink because of the water around them. Ships sink because of the water that gets in them. So try not to let what's happening around you get inside you and weigh you down. You've got this, you can do it. Encouragement, again, and a little humor, nerdy humor maybe. Sorry, this is when my husband says, please stop telling jokes, and I probably should. But I want you to know that in addition to CARF, LPP, Let's Put Out the Fire, I am very new to this. There's not a ton of posts, but I am starting new things on Twitter and on Instagram with my hashtag #HairWithDrMayor. So stay tuned. I'm hoping to become more active on both of them to try to dismiss myths and answer important questions and bring important information that's evidence-based and helpful to all of you. So I'm really grateful to be able to be here. Thank you, Jean Pickford. Thank you, Mike, for making this possible. And I'm happy to answer any questions people might have.
That was absolutely wonderful, Marianne. Thank you so much. I learned so much just watching it. I'm sure everybody in our audience has learned a ton as well. And I appreciate you interjecting the humor and trying to keep it light, because I do know that this is a very serious condition, and the situation right now, people really have a tendency to, increase their anxiety, the fear of the unknown. So thank you so much for doing all that. Okay, so for those of you who are just joining us, I want to let you know that we are now talking with Dr. Marianne Senna. She is the assistant professor at Harvard and the director of the hair clinic up at Mass General in Boston. She is talking about scarring alopecia and the impact for patients with the COVID-19 virus. So we're ready to take some questions. If you can, here they come. So we have a question here, Dr. Senna, that says, what types of vitamins should those with scarring alopecia take to support their immune system during this time?
Yeah, so that is a really great question. And by the way, I should mention these wonderful people here on this slide are my nurses, my research fellows, my colleagues. All take care of people with scarring alopecia. I love them. Couldn't do my work without them. I forgot to say that earlier. So great question. So here's the thing. This is not necessarily my recommendation, but because you have asked the question, I will only share with you the data that is known about what's helpful. So the first thing is the nutrients that we get from our diet, the micronutrients from our diet, macronutrients from our diet are so much more important than any supplement we can possibly take. So having a well-balanced diet is super important. There was one study back from 1999 that looked at patients who had the flu or other similar sort of cold viral syndromes. And they looked at patients who took megadose vitamin C versus those that did not. And what they found, and what they defined as megadose vitamin C was 1,000 milligrams every hour for 6 hours. It's a lot of vitamin C. Then 1,000 milligrams of vitamin C 3 times a day thereafter. And what they found is that if you took that mega dose of vitamin C prior to or once the symptoms of a viral respiratory illness started, your flu and cold symptoms decreased by 85%. So again, I have not tried this myself. This is not something that I am saying definitely works, but I'm just sharing the data that's known on this subject. Outside of that, I don't know of any other things other than having a well-balanced diet that will really help prop up your immune system.
Interesting. Okay, good. So we have some more questions. I usually get injections monthly. Is this considered elective, given this current scarcity with medical supplies?
Yeah, so that's a great question. If you're just going in to see your dermatologist or hair loss specialist because of hair injections, I would strongly advise you to not go in. And this is a really tricky one because if you've had benefit from the injections, I can understand why that might cause anxiety and concern around that. One thing I wanted to share, and Mike, I'm just going to fast forward here through my PowerPoint because I want to show them the image of this, if you don't mind bringing it up. So this is something that's about $100 or so on Amazon.com. It's called Dr. Pen. So if you're staying out of the clinic, you've gotten benefit from injections, and you're worried about not getting injections at home. This is not evidence-based, but this is what I would do. It's sort of like a poor man's attempt at kind of getting deeper penetration of topical medications. So that could be topical tacrolimus or pimecrolimus or Eladella Protopic, or any topical steroid into the skin. This Dr. Pen is a microneedling device, so it pokes little holes into the scalp. And you'd want to, on the scalp, use probably like the 1.5 millimeter setting. And if you did that maybe once a week or once every couple of weeks, 2 to 4 times over the areas that you're going to apply the topical steroid. So again, once a week, once every couple of weeks, 2 to 4 times of the affected areas that you're treating, and then put a thin layer of the topical steroid either the day of or the day after. That's one way to maybe try to get to the benefit of the injectable steroids that you're getting in the doctor's office. Thanks, Mike. Appreciate that.
Okay, great. So do we have some more questions that are going to pop up? And also for you that are watching, if you have a question, go ahead into either the Facebook link or the YouTube, and underneath the video, right below the video, you can type in your question, and we will get them, and we'll be able to post them here momentarily. It looks like I froze. Okay, Dr. Senna, can you still hear me?
I can hear you. Yay, technology.
Oh, good, good. Okay. So are we causing more... Are we causing symptoms and hair loss when we need to wear a hat or a hairpiece, especially out in the sun?
So it's a really good question. I get this a lot from all hair loss patients, not just inflammatory hair loss patients or scarring alopecia patients, but every patient. And I think it's largely sort of Can everyone hear me okay? So
yes, please keep going, Dr. Senna. Please keep going, Dr. Senna.
Okay, so basically it's a really good, and thanks guys for dealing, okay, thanks for bearing with us, guys. You know, there's a lot of people using Zoom these days, and we're trying to bring you the best information here. But basically, you're not the only ones who are asking this question. All of my hair loss patients ask questions similar to this, and certainly because a lot of patients with scarring alopecia will say, you know, my scalp feels worse, my scalp feels more itchy, or it seems more red when I wear a hat. Yeah, that makes sense. Like anytime there's more heat, you're going to feel those symptoms or see those signs more. That doesn't mean your disease is flaring. And so I say to my patients all the time, wearing a hat, wearing a headpiece, wearing a wig, wearing anything like that should not affect the degree of your hair loss or whether or not you experience hair loss and inflammation over time.
Okay, I'm going to read the next question to you. Go ahead, Jean.
Oh, I can.
Go ahead, Jean.
Okay, sorry about that. We're having a little bit of connectivity issues here, and I can see myself going in and out, and Marianne's coming in and out. So I apologize for that. Everybody's using Wi-Fi and the internet for all their communications these days. So we're hoping that this will improve shortly. So Dr. Senna, in treating frontal fibrosing alopecia, how long do you give each treatment before you will consider changing?
I never change anything. I mean, depending on what it is, but I never change anything in shorter than 6 months' time. And that's 6 months' time of the patient promising me that they're going to be crazy compliant, because understandably people want results quickly, and that's just not how a lot of these medications work. How most of these medications work. You have to be compliant with them over long periods of time, because the hair is very different than other things. You know, you see a rash on your skin, you put a cream on it, the rash goes away pretty quickly, right? That's not how hair responds to treatment. You need to be on something consistently in a dedicated way for at least 6 months before you call it a failure.
Okay. What is the update on microneedling? Anything else promising in the pipeline right now?
So yeah, we did a microneedling study in female pattern hair loss, which was very, very promising. We're hoping to be able to publish our results soon. Unfortunately, we had a bunch of patients who signed on for our microneedling for cicatricial alopecia study, which we had to cut short because of COVID-19. So we didn't want to bring in patients and put them at undue risk for this clinical trial. So I'm hoping in the next year, year and a half, depending on how long this goes on, to be able to have results. That is something we're actively working on. We have the IRB approval for. We have patients who are signed on for it, which we've just had to hit the pause button on it. So more to come on that, hopefully very soon. But I do hope that it'll be promising, if not for its ability to add to follicular rescue, right? Hair follicles that have not hit the point of no return, that we can get medications there more effectively and be able to rescue those hair follicles and regrow hair there, but also perhaps maybe allow for a little de novo or new hair follicle regeneration, but more to come.
Okay, I'm in the pause mode again. Oh, no, I'm back up here. Same question I think we have on microneedling. Is anybody else posting any questions right now live? We have about another 10 minutes with Dr. Senna. So if there's something that is troubling you or you'd like to ask her about COVID-19, we'd be happy to take your questions. Again, you can post them on our Facebook Live and on our YouTube page. Okay, we've just got another one. I was wondering if scalp transplants, either part or whole, could work to replace the affected areas of scarring alopecia. Has that ever been looked into as an option, and are there any other studies going on?
Yeah, so this is a really tricky one, and part of the reason why it's so tricky is because, as you all know, scarring alopecia can be such an unpredictable condition. So, you know, what I say is, yeah, you know, if you have a reservoir of hair follicles elsewhere on the scalp, could they be transplanted to an area where you don't have hair follicles? Absolutely. The problem is, though, that if there's a chance that your active disease could come back, you're going to go through all of that surgery and money and everything for naught, because eventually the inflammation will come back and it'll affect those hair follicles as well. So what I say is, the longer a patient is out from being in remission, the better chance there is of even considering something like that. So, for example, you know, you have not had any signs of inflammation, redness around the hair follicle, scaling around the hair follicle, symptoms, you know, hair loss that you've noticed or that your physician has noticed for 10 years. And you want to attempt this, probably okay. Not a guarantee, but probably okay. If that's never happened or it's been a year, then that's not something that I would advise doing.
Okay. Good to know. Good to know. So I have been seeing a dermatologist for an itchy, irritated scalp. He has prescribed medication which has helped, but it returns as soon as I stop taking the meds. Any recommendations to resolve this issue? Yeah,
so unfortunately, it's a great question. All these questions are great. with skin conditions in particular. So for a lot of these conditions, they're chronic, meaning that they wax and wane, right? And yeah, when you use a treatment, they get better. And then when you don't use a treatment, they get worse. And there's no, it's not like if you get an ear infection and you take the antibiotic and the ear infection goes away and you don't have to worry about it again, right? This is very different. These skin are very different, because innately we always have something that could sort of stimulate them to come along if we're genetically predisposed or otherwise predisposed to have these things. And so there's a couple of ways around that. The easiest way is with the easiest information will recur, right? The longer that, if you're using topical, and come right back. And so there's a couple of ways around this. You can either hit it hard for 2 weeks and do it like once or twice a day, depending on what your doctor tells you to apply, and then sort of go into maintenance mode where you say, okay, only once a week, slowly down, and that allows a greater length of time where you don't have symptoms, and then repeat that cycle of twice a day again. And so it's very much a personal sort of decision which one of those appeals more to you. But unfortunately with these chronic conditions, at least when they're really, really active, unless they've been quiet for a very long time, it's unlikely that based on what we know now, we're actively working to try and figure this out, I promise you. Based on what we know now, as long as you're symptomatic and you have active disease, you need to continue at least some maintenance therapy to keep those symptoms at bay.
Okay. I think we have time for one or two more questions. So I see many ads for psoriasis for skin inflammation. Since my scalp, especially at my hairline where I have hair loss, where my hair loss becomes inflamed, have any of those medications worth trying for scarring alopecia?
Yeah, so another great question. So psoriasis, I'm trying to say this in a way that is going to be confusing for people, but there are different inflammatory cells in our body. And they're sort of in categories. So like say there's category 1 and that causes scarring alopecia, and category 2 and that causes psoriasis. Category 3 might cause something else. There are certain medications that we have that fit into those categories and treat the cell types that lead to inflammation in those diseases. The problem is that there's not a lot of overlap between one category and the next. And so for the most common types of scarring alopecia, LPP, FFA, CCCA, a lot of the medications, there's not overlap. So between the medications that we treat for psoriasis, there isn't a lot of overlap. However, in the less common types of alopecia, scarring alopecia, dissecting cellulitis, folliculitis decalbans, there are some medications that have been used and have been shown to be effective in those scarring hair loss conditions. But by and large, because they sort of target a different, say, axis of the immune system, they're not all going to be as effective for scarring, the most common types of scarring hair loss conditions.
Okay. That's great to know. So I know that you are doing new research studies. How can people support those efforts with donations?
Oh, God. I mean, what I will say is, the only reason why I've been able to do any research in this is because I had one extraordinarily generous patient who just said, like, I want to do this. That's the only reason why I have a research team and I'm able to do anything for scarring alopecia. And if I have a minute, I'd love to share results of one of our most recent studies that I hope will be somewhat helpful or interesting to people who have chosen to tune in. And if you have a friend with scarring alopecia, please tell them to come on, because I think this will be of interest to them. But the bottom line is, guys, people like me who treat these things all the time, Jeff Donovan, I mean, there's Wilma Bergfeld, Maria Hordinsky, Rhonda Farah, Jerry Shapiro, Kumar Suketo, Kristen Losico. I'm probably missing people. Okay, there's a million of us out there, George Kotsarelis, who see patients with scarring alopecia and feel so heartbroken that we want to do more. The problem is this. it's not psoriasis. You're right. Like, the reason why those ads are on about psoriasis is because psoriasis to industry people, right, pharmaceutical companies who are also like starting to ramp up and become more interested, are funding these studies because they understand that there is an unmet need in the public. Those of us who see you all the time know this is much more common than we think. And I think the most important thing we need to do is prove that first and foremost. But also,
Agreed.
Until that happens, we need to have your support. We need to say, like, you guys are going to come to the forefront. You're going to contribute. If you want to send a check to me, we'll be glad to take it. You would send it to my attention. I can post the information I can give it to Jean and she can post it on the CARF website. I can also put it on my Instagram page. But yeah, we need it to be a patient-grounded effort. Do I have a minute to share my research results from before, or no? Are we ending now?
No, we're going to wrap it up right now. But we are certainly, well, that's a great segue, Dr. Senna, to the next thing I want to talk about is that we're going to be doing these webinars again in the future. CARF and Colleen and I and the board, we've all agreed that this is a great way to communicate with our members and our database. So we have implemented something called In the Know, and they're going to be hour-long webinars, one each month for the next, right until the end of the year. So we're going to have Dr. Senna back on to host another webinar later in the year, and she can share some of that information with you. We also are going to be sending out our quarterly newsletter. We were doing a lot of email blasts and short little informative things over the past year. We're now going to start taking some of the information and holding on to it or combining it into one big newsletter that's going to come out every quarter. And the next one, or the first one of this, is going to be coming out at the end of this month. So you can look forward to that. And then also, to dovetail to what Dr. Senna said, is that we need to rally as an organization and as a group of patients who are affected with this condition. I completely agree. I don't think that there is, it's a rare disease. I think there's a lot of people that are affected with scarring alopecia, and that's indicative by the number of patients that call us, email us, and send us, join us through our website. So we as an organization are here. We are organized. We have the staff in place who really want to do a lot and want to take this organization to the next level. We want to be at the table when people are talking about scarring alopecia. We want to be with the doctors and the researchers. We want to be present at the meetings and the conferences. And we want you to be a part of it. And that's what I'm advocating, is to have a really strong relationship with our patients, with our members, with the office, and with our board. And so I highly encourage you to continue to support the organization. We are on a trajectory that's getting growing. We have new board members. We have patients, like I said, joining every day. On average, there's about 50 new patients who has scarring alopecia that contact the organization. So you can imagine what that is, how that is for our database and the power that we have and the number of patients that have this condition. So join us, become part of the movement, become part of CARF, and really support this organization, because we are going to speak for you and we're going to be there for you. So I think that's it. I'm sorry if you had any questions that were posted and we were not able to get to them. We'd like to keep these webinars to 1 hour, so we're going to wrap it up here at 7 o'clock. Just want to say to Dr. Senna, thank you for doing this for us. I know that there's a lot of people out there that are very relieved and that have been enlightened with this great information. You put it in such a way that it's easily understandable, and our patients are very, very grateful. I speak on their behalf.
I always speak on all of their behalf too. Thank you, Jean. It was really fun for me and important for me to be able to do this. So thank you for the opportunity.
Yay. Okay. All right. Well, thank you, everybody, and check back in. We're going to put these links live. These links on our Facebook page, and on we're blasting out on eBlast. We're going to put them on all our social media channels. So if you were not able to join us tonight, you'll be able to join us by yourself at your leisure and be able to hear all this great information. So take care and stay safe and stay healthy and stay in touch with CARF. Bye.
Bye.